Examining newborns immediately after birth is important for determining general condition, developmental status, abnormalities in gestational development, and any congenital abnormality. The APGAR score is an assessment of the newborn immediately after birth. Score is 8 or more. Proceed to a more complete examination. For more accurate in getting the height, use a stadiometer and measure the patient holding the hips and knees and fully extended. In weighing the infant directly, it should be naked or with diaper, and weigh the diaper itself. Important to measure the head circumference during first 2 years of life. Place the measuring tape over the occipital, parietal, and frontal prominences to obtain maximum circumference. In measuring the chest circumference, place the measuring tape at the level of the nipple and measure at the end of exhalation. In measuring the abdominal circumference, place the tape measure above the level of the umbilicus. Blood pressure is routinely measured over 3-year-old. In getting the pulse rate, palpate the femoral artery or brachial artery or auscultate the heart. Inspect the skin texture and appearance for any lesions, discolorations, and rashes. Note any birthmark of the infant. Palpate or pinch the skin to assess the degree of hydration or turgor. Check for any discoloration by applying pressure to the skin. Examine the eyelids if there is any gross deformities or lesions. Inspect for the shape and position of the eyes and check for any discoloration of the sclera, conjunctiva, and any discharges. Palpate for any swelling around the eye area. Inspect for the position of the ears in relation to eyes. Check for the shape or any deformity. Check for any discharges. Inspect for any structural abnormalities. Using the otoscopic examination, check for the patency of the ear canal. Inspect for any gross deformity or asymmetry. Cover each other side of the nostrils alternately while holding the infant's mouth to inspect the patency of nasal passages. Inspect if the nasal septum is midline. Important to inspect the external structures prior to inspecting oral cavity and mucosa. Check for any gross deformities such as cleft lip or lesions. Inspect the mouth of the infant using the tongue depressor and flashlight. Inspect the tongue color and size. Palpate the upper hard palate to make sure if it's intact. Take note that newborn's mouth is dentillous and the alveolar mucosa is smooth with finely serrated borders. Occasionally, pearl-like retention cysts are seen along the alveolar ridges and are easily mistaken for teeth. These disappear within 1 or 2 months. Inspect for any presence of swelling, masses, discoloration, and posturing. Check for any vein distension. Palpate the lymph nodes of the neck to assess if there is any mass. Also, palpate the clavicles and look for sign of fracture. It is best to palpate in supine position. Auscultate for the presence of bruit. Inspect for any deformities such as pectus excavatum or pectus carinatum and for any symmetry. Inspect for respiration and breathing patterns if there is audible wheezing sound. Palpate for any masses and assess tactile fremitus by placing your hand on the chest when the infant cries or makes noise. Place your hand or fingertips over each side of the chest and feel for symmetry in transmitted vibrations. Inspect if there is any cyanosis, and you may use oximetry measure to confirm the saturation. Inspect the respiratory rate and pattern. Auscultate the S1 and S2 using the diaphragm. S2 is easier to detect if the infant is completely quiet or asleep. Inspect for the counter and appearance of the abdomen and check for any varicosities, protrusion, or outpouching of the abdominal contents. Inspect for the presence of masses or discoloration. Check for the presence of the umbilical stump. Check the area around the umbilicus for redness or swelling. Auscultate for the presence of bowel sound. Palpate if there is presence of organomegaly. Inspect for the size of the clitoris, color and size of the labia majora, presence and location of urethral orifice. Check for any vaginal discharge. Assess for the hymen. Have infant regard your face and look for facial response and tracking. Darken the room, raise infant to sitting position to open eyes. Use light and test for optic blink reflex. Use the otoscope's light to assess pupillary responses. Observe how well the infant tracks your smiling or a bright light, and whether the eyes move together. Testing sucking reflex. Watch the infant suck breast, bottle, or pacifier, and the strength of the suck. Observe infant crying and smiling. Note symmetry of the freeze. In testing the acoustic blink reflex, blinking of both eyes in response to a loud noise, such as snap or clap. Observe coordination during swallowing. In routing reflex, stroke the perioral skin at the corner of the mouth. The mouth will open and the infant will turn the head toward the stimulated side and suck. Testing the Moro reflex, hold the infant supine, supporting the head, back, and legs. Abruptly lower the entire body about 2 feet. The arms will abduct and extend. Hands will open and legs will flex. The infant may cry. Testing asymmetric tonic neck reflex, with the infant supine, turn head to one side, holding jaw over shoulder. The arms or legs on side to which head is turned will extend while the opposite arm leg will flex. In testing gallant reflex, support the infant prone with one hand and stroke one side of the back 1 cm from midline, from shoulder to buttocks. The spine will curve toward the stimulated side. In testing Landauer reflex, suspend the infant prone with one hand. The head will lift up and the spine will straighten. Hold the infant around the trunk and lower until the feet touch a flat surface. The hips, knees, and ankles will extend. The infant will stand up, partially bearing weight, sagging after 20 to 30 seconds.